While the entire world is confronted with the rapidly unfolding COVID-19 pandemic, there is another slower pandemic spreading across the globe and threatening human health around the world. A threat which gets no headlines: the pandemic of antibiotic resistance. Antibiotics play a crucial role in all healthcare, and many of us take them for granted. But rapidly increasing antibiotic resistance threatens future care in the community and in hospitals. This is a growing global challenge. Especially children in low and middle-income countries are at risk. Many of these children lack even the most basic health care, making the situation worse. Every third minute a child dies from sepsis due to antibiotic-resistant infections.
I think we've been through a period of tremendous drops and progress in reducing child mortality in the world. One of the key ingredients has been working and effective antibiotics, and those are now under threat, and that threatens gains in the newborn and the older age period. We need working and effective drugs as part of our continued push to drive down child mortality.
This is Kiambu in the outskirts of Nairobi, Kenya. Children here, like in many African countries, are often affected by different kinds of infections, many of which are resistant to antibiotics. Pneumonia is still the leading cause of death for children under 5 in Kenya. Most of them do not get appropriate antibiotic treatment.
The fact is, in a few years to come, everybody will be in a problem because we will not be having drugs that are responding to common infections. The doctors will not be having drugs to prescribe and treat to their patients because of drug resistance. I mean, it's a disaster for everyone, and it's important for the policymakers to ensure that the issues of antibiotic resistance is actually addressed as one of the causes of death in every country.
My name is Elizabeth Karongari. I'm a mother of 2 young boys, a 7-year-old and a 1-year-old.
Most parts of the world, when your child is sick and you have another couple of kids and you need to go to work and the health center is far, you go to the local pharmacy and you buy something over the counter.
When he has a flu but doesn't have fever, but I see the flu is constant there and it's not subsiding, so I'll just go over the counter, the chemist, and ask for medicine. I just think of anything and then I say, just give him this and that. But I don't feel that they don't necessarily think that it will work to the kids, or they just give it, and then maybe after 1 week I'll come back and ask for more.
What we saw from Nairobi and Kenya here is very similar to what we see around the world.
In Southeast Asia, antibiotics are widely used for children as well as for the entire population. This is the capital Hanoi in Vietnam. Studies among children here shows that the majority use antibiotics every month. At the Vietnam Children's Hospital, staff are frustrated over the rising numbers of resistant infections that hamper their efforts to save the lives of the newborns. Every day, newborns die of sepsis at the clinic, and the situation continues to worsen.
Today we had to receive patients with antibiotic resistance every day, and the situation is difficult now and will be more difficult in the future.
At the hospital, the staff carry out an active infection prevention control program with measures such as careful hand washing, protective clothing, early detection of resistant bacteria through screening of the admitted children, and cohort care, with very good results, supported by the Ministry of Health.
We're in the COVID times now, and I think that's a fast and loud epidemic, but it has also shown that we can actually come together as a world. Now, we have a slower and faceless epidemic in antibiotic resistance. We need the same solidaric response in the world to come together now, to actually develop new drugs, actually maintain the ones we have, the current ones. We need to fix good access to quality healthcare for everyone, and we need leadership.
Antibiotic resistance must be pushed higher up on the global political agenda. Unless work to address this current crisis is quickly sped up, even more children will die from infections that cannot be treated. The entire world mobilized quickly against the COVID-19 pandemic. Now the global community must come together once again and do the same for antibiotic resistance. Funding of this crucial work must be allocated. Action must be taken now. We cannot afford to wait.
So good morning once again, and thank you so much for making time to join this session, and a special welcome to our two experts that are joining us today. I'll introduce them shortly. Before we start, can I ask for a volunteer to pray for us?
Okay, let's humble ourselves by prayer. This is Ruth Ketty.
Thank you.
Almighty God, thank you so much for the gift of life. Thank you for your protection. God, I want to commit today's session into your hands, that God, may you guide us, may you guide the facilitators, may you give them the wisdom and knowledge to be able to deliver fruitfully, and may you protect us, and may you continue to bless the organizers of this training session. I pray that you may give us the concentrations as the students to be able to listen in till the end of the session. I pray all this in Jesus, in the mighty name of our Lord Jesus. Amen.
Thank you so much, Ruth, for praying for us. So before we get into the session today, we'll just quickly look at our session for last week, which was a very good session where we're looking at design thinking and systems thinking. And I will not, in the interest of time, I will not really ask people to talk about what they remember from the session last week, but instead I'll just ask anyone, whatever takeaway you got from the last session, you can just put something in the chat, whatever you remember from the group discussions that we had, very good discussions that came out, and also our main speaker was Diani, who actually shed a lot of light on systems thinking, on how we can make sure we use systems and design thinking in coming up with interventions in AMR. So you can just put in the chat any key takeaway just to share, so that we can be at least looking at that as we go through the session. So today is a very special session in the sense that it's actually a final one for these presentations we've been having from the experts. And I would like to sincerely thank you all for making time. These sessions, I know, are on Saturday. We appreciate the fact that your students, you will be having assignments, exams going on, but indeed we are creating AMR champions for sure, because there are some names of people who never missed the session. You'd make sure that you attend, and I'm sure and hopeful that you actually learned a lot right from the launch session we had on the 16th of July, and looking at the online course that we did for the first month, the national action plans, One Health. We also talked about antimicrobial stewardship, infection prevention and control. We also looked at the animal sector, how antibiotic resistance is being a very big threat in that sector, sustainable health food systems. We had a session on that, leadership, personal competencies. So well done, and thank you so much. So without wasting much time, next week we'll also have a session we won't have any guest speaker, but we'll just clarify the next activities for the remainder of the year, especially what needs to happen for the rest of October for your projects. So it's indeed a very good way of ending these sessions, and we are truly honored today. Daniel will talk more about I saw he posted some materials in Slack, and also a course on project management, just that short one. If you get a chance, just go through and do it. And also he shared a publication that our director actually co-authored in Slack. You can also go to Slack and just read it during this weekend. So today, as I said, we are truly honored to have speakers that will take us through a session on project management, on monitoring and evaluation. And we'll start with Professor Raphael Nyonje, who will be followed by Dr. Ponari Gopati, who will actually talk about a case study of a very successful project that she is actually a co-founder on in Asia. So it's going to be a very interesting session today. And as usual, if you have any comments or any questions that you have as the sessions are going on, remember to put them through the chat box, and we'll have a session after the two speakers have spoken. I will leave as soon as I introduce the first speaker, because unfortunately there's a clashing meeting this morning that I have to attend. But my co-moderator, Daniel, will remain in the session and will also facilitate the Q&A session. So I will introduce our first speaker for today, who is Professor Raphael Nyonje. And he holds the Doctor of Philosophy in Educational Research and Evaluation from the Catholic University of Eastern Africa. He has been teaching project management and project M&D for over 20 years at the biggest university in Kenya, University of Nairobi. He has also supervised over 100 postgraduate students in research, focusing on various issues in project monitoring and evaluation. He has designed and implemented a number of academic programs at the University of Nairobi, the most recent one being an M&D of HIV programs, which is a capacity building fellowship program for health managers. The program is housed at the University of Nairobi Institute of Tropical and Infectious Diseases under the College of Health Sciences. And Professor Nyonje has published quite widely in the areas I mentioned above. There are links on the publications he has on Google Scholar and also ResearchGate. We can share those links through the chat. And one of his books that is widely used by students and project practitioners, actually in guiding them in project implementation, is one called Project Monitoring and Evaluation, a handbook for students and project practitioners. So I think it would be good if we can get a chance to get hold of that book, because it really will be helpful for us. He has served in various managerial positions at the university and was the chairman of the Department for Research and Evaluation and Long-Time Learning Courses until 2021. And outside the university, Professor Nyonje is the chairman of International Project M&D Society, IPROMES, a society that houses all project monitoring and evaluation managers and practitioners across the globe. It's a network organization. He is also a chief editor of the Kenya Association of Project Managers and a member of the Kenya Quality Assurance Network based here in Kenya. So over to you, Professor Nyonje. You've got a maximum of 30 minutes just to shed some light on project management and M&D. Thank you.
Thank you, Julian, and good morning, good afternoon, everyone. I don't know where we are, but I hope you are fine. As you've heard, my name is Professor Nyonje from the University of Nairobi. I've posted, I've just posted a link to our chat. If you feel that you have something that you want to express in relation of what we are going to discuss, please go to the click that link, and I just wanted to share with you the link. I'm happy one person has entered. So please click on that and you'll all be on this. What do you think about my presentation? And you can stick here. Use the fourth button. I hope you're seeing the fourth button. You can click on it and just post your thought here so that when I'm through, we can be able to go through your post, and you can actually select any color here of how you want your sticker to look like, and then just post here. Then we'll be able to go through your comments as we go through the discussion. Please don't use the first button. I can see members are using first button. Use the fourth one. The fourth one has it's the sticker. From up, count 1, 2, 3, 4. Click on that, and you'll be able to post your comment. And we'll be able to go through that comment when I'm through with my presentation. Allow me to share my screen. All right. Can you be able to see my screen?
Yes, we can see it, Professor.
Yes, it is very clear.
Okay, thank you. Ladies and gentlemen, they have been given a task of just addressing you about project planning and management. And I just want to take a generic look at the project planning and management plus all what constitutes it. This is a very wide area. And I think you bear with me with what I've selected for our discussion here. I'll try as much as possible to bring in some examples that are related to the health sector, because I've actually been facilitating programs related to health. I'm actually the monitoring and evaluation track lead of the Tropical Infectious Diseases Institute of the University of Nairobi. And there are certain things I've picked which I've brought in so that we can discuss, and you relate it to the course that you've been going through on antimicrobial resistance, which I know there are certain things that you also requested to do in terms of a project. Maybe this presentation will be beneficial to you. There is just a wide kind of request from the organizers that if I try my level best, talk about project planning, design, and also talk about problem tree, which is very important for any person planning for a project to understand, and look at maybe issues related to project life cycle, monitoring and evaluation, and challenges in health projects, and how to how to design maybe a guide on how to design a project, because I'm told that there is an assignment or something that you'll need to carry home after this training. I'm really happy to be here, and I'm really happy to talk to you. And I hope what I've prepared for you is going to be beneficial to you. So first, I want to look at the concept, and I think I have 30 minutes. Try to rush as much as possible. The first thing that we need to understand is what is a project? And a project has been defined differently by many people. And I just picked one or two definitions, which, because when I read through the definition, looked like they're talking of one and the same thing. For example, Singh and Nyandemo talks about a project as an endeavor in which human, material, and financial resources are organized in a novel way to undertake a unique scope of work of a given specification within constraint of cost, time, and prevailing environment. When I looked through all the definition, the most cutting across issue was the issue of beneficial change, which is part of what we are going to look at: impact, beneficial change. And these changes must be seen in terms of quantitative and qualitative. And if you look at many other definitions, they talk about that a project is designed to meet certain objectives, certain goals, and that's why objectives are there. So we'll be talking about these issues. But you need also to know that a project must have a start and must have an end. Therefore, whatever you have designed in terms of that project must be completed within that specific time that you have given that project. For example, if it's a project of 5 years, whatever you have designed, that objective that you have must be achieved within 5 years. Failure to that, then it means that the project did not actually provide the benefits that it's supposed to provide. Just looking at, I don't know whether you want to move this. Can you be able to see properly the screen?
Yes, Prof, it's visible. Yeah, okay. There are different views, so one can select side-by-side speakers, so it's visible. Yeah.
Good. So there are concepts like planning, and planning is just about rationalizing about your initiative and trying to ensure that whatever you're putting in place are things that can be sustained or achieved within that framework that you've been given. And the planning itself is a prescribed path. And when you're planning, you must go through a certain process. And this process includes, number one, that you must establish project objectives, and we shall try a bit to see how do you establish project objectives. Then after that, you must choose the best strategy that you can use to deliver the strategy for achieving the objective. And then you must also break down now the objectives into activities, into certain things, and provide standards through which you'll be able to check through and know that you are achieving your objective. Then after that, you must move to another process where now you have to say, yes, you have activities. what are the resources that are going to ensure that these activities are implemented? And therefore, you have to now start looking at resources. You must look at, time is also a resource. You must also put some estimation on this, those activities, and see how you can now sequence this timing on each activity sequence so that they can actually consolidate themselves into a deliverables that you have designed for your project. What is a design? A design, and this, what we are going to see is a kind of a charter. It's a document. This is now a crucial, the design provides a crucial stage in the project life cycle. It's the starting point, because you must have a document which is detailing what you have planned and how you have documented your plans. And it answers 4 basic questions. Number 1, what is the project that you're going to deliver? And where is this project going to be delivered? And this is now talking to internal and external environment. When is about the timing of the project. And I've said a project has a start and an end. But if you go deeper, you'll find that a project activity also have certain timings, which also needs to be looked at, and it consolidates into the main start and end of the project. Who is about the team that is going to roll out that project. So in a project document, you must detail what the project is, the title, and the background around it. You must also detail the environment under which that project is going to be undertaken. You also need to look at the timing and the scheduling of activities per the timing. And you must actually look at the team that is going to implement that project. And including having a clear flow of the communication within that project. Because we know communication is very important in any project. A project life cycle is a way we start now looking and interacting with the phases within a project at the start up to the end. And maybe this is what we started seeing in around 1970, when World Bank came with the generic phases that required those partners with the World Bank to follow as they design and implement project. So this is something that has been there, and we will find that the project life cycle has a different way of being documented by different agencies. So like International Federation for Red Cross has a way of looking at these phases. We have others like United Nations Center for Regional Development has a very detailed project life cycle that requires those who are partnering with them to adhere to it. Now, the most important thing about project life cycle is that it shows the phases through which the project idea you have goes through to maturity. How the needs of our society, the needs of the community are transformed. So it's that documentation of that journey of how you're going step by step, coming first with an idea and working with that idea through phases until you see the image of what you want to see at the end of the project, because the project must address certain issues. The project must meet certain demands of the beneficiaries. So again, project life cycle phases, according to Martin, and this is the latest, you can be able to look at this, has the phases, and the first phase is its initiation. At the initiation level, you are talking about the project definition. You must bring that project to be very clear that it is addressing the problem that you have identified. And issues of constraints must also be understood at this level. At this level, you must do something like need analysis, situation analysis, to be able to define the problem statement clearly of your project. Now, the other one is the planning phase. And sometimes there is a lot of overlap between the planning and the initiation phase. There are certain things that are within initiation, but you find them from the side of planning phase. And at this level, planning level, this is where now you detail, you come up with a detailed plan. For example, you must estimate, you must come up with the estimate of time. Activities must have appropriate estimate of time, estimate of material, estimates of finances must be very detailed here. And then scheduling. It's not just scheduling. You must come up with activity and try as much as possible to see how these activities all overlap, which one comes first, which one comes second, which comes last, which one must be done before any other activity is done. So this is where now you start putting your thinking into the document on how the activities will follow one another for the purpose of delivering the outcome. Then execution. This is where the tire meets the tarmac, that you have to roll these activities. And therefore it demands that, number one, the procurement that you had planned at the planning phase must be rolled out. The team that are going to implement the project must be procured, trained, and actually put in the place of responsibility to undertake the activities. Resources and finances must be utilized. This is where now the monitoring, which we are going to talk about, takes place. You have to monitor how much. We said we are going to plan for this, we are going to implement this. Did we implement? We are going to spend this by this time. Did we do that? And if we did not, what happened? And then project closure, this is where now you have to do everything like the end term evaluation, you must do that, and you must close activity, and there's a different way of doing the closure. So let's look at project goals and objectives. And I just wanted maybe us to start thinking the small assignment that you have of thinking about a project at the community level or at a level where you are in space of implementing. How do you design it? How do you start thinking about it? And I think the issue that we are going to talk about is, how do you get the project goals, and how do the project goals look like? How do project objectives look like? So when you look at project goals and project objectives, there is a big difference. A project goal is the ultimate objective of the project. It is the reason why you are undertaking that project. It is normally stated in general terms. For example, improve sugar production in Kenya, or increase level of employment among the youth. It's very general. And we will see how maybe from the problem tree, how do you get into stating the project goal. Project objective is a situation. It is the problem. It is that situation which is described by the problem which you have done that is expected to be present at the end of the project. If, for example, the community is suffering because they do not have water, at the end, water must prevail. And that is the objective of any initiative that you're going to put in place to ensure that water is available. And I'm just using an example here. At the end of the project, 200 women in Madare slums will have received training in reproductive health. The situation that you want to see is that the women, you have empowered women in reproductive health. And you're just being specific by saying the number you want is 200. We shall see how now to state this in details if time allows. Some objectives normally that we have stated in the that you will find yourself stating in the project document is the outcome, and the outcome is about the short-term results that you want to see. Well, at the end you want to have 200, but in the short term, what do you want to see? And you see this one as stated in a log frame. And this shows how the target population will be changed. The outcome, for example, the outcome of industrial focus project may include increasing cell volume. So you want to produce and supply, and your aim is to increase your cell volume by a certain fraction if we have to make it smart. Then we have process objective, and this is what you want to achieve as the process continues. And then the impact is the long-term kind of results that you want to see at the end. Now, sometimes planners use a problem tree, and this is what I was requested to talk about, in identifying all problems that give problem that a project needs to address. Now, what I want to explain to you is how to design a project objective, but I want to base it on a very simple logic that if you have a problem, on one side of the problem is the solution. The problem is on one side of the hand, but at the back, if you look at that problem, at the back, the problem is actually lending a solution to you. So when planners use problem tree technique, they would want to scan around the environment and identify problematic conditions. Out of these problematic conditions, they start studying them and looking at the other side in terms of understanding and getting the solution. And I'm told when there is a disease, scientists are very worried and they really want to see how does that disease manifest itself? What is the composition of the elements that causes that disease? And it's within those elements that scientists figure out the medicine or the treatment for that disease. It is the same thing that we want to talk about. A problem is a situation that is judged as something that needs to be corrected. So if there is a lot of resistance on antibiotics, and you look at it and the prevalence is just worrying, then that is the problem which needs to be changed. This is a situation that needs solutions. And it's out of this problem tree that you can figure out the solution. For example, in your rural areas, there's lack of electricity. That's a problem. So how do you fix the problem? And the possible solution will be provide solar panels, provide hydroelectricity, and this could be now the projects you're talking about. The project becomes now the solution. So we are simply talking about a project which is rural electrification in terms of either providing a dam or something. So this will provide now electricity, which will address the problem that was there. Now, when you're talking about a problem tree analysis, you are possibly talking about a tree. You have a tree. This is a tree. And I think I want to bring the image of a tree here so that we understand problem tree analysis. So this tree, you have to look at it in parts. And you can see now, I have now described the tree. Under the roots, where the roots are, is what we are calling the root cause of the problem. That if you uproot the roots of this tree, then you will not have this tree thriving the way it's thriving. You know, it's very green because it's well taken care of. And that's how problems look like. Problems can look like well-nourished. And you can actually go to a village and just see, when you enter a village, you see under 5 kids with protruded bellies. This is a manifestation of a problem. So this is now the tree we are seeing now. Now we need to dissect this tree so that we understand where does the problem comes from, how is the problem manifested itself, how does it manifest itself. The root cause represents the roots of a tree. The trunk is the underlying causes. And the immediate causes are the branches that you see, and the fruits and leaves now is the manifestation of the problem, because the problem can take root until it starts flowering and producing fruits. And these are not things that I'm talking about this, but some of the fruits we are seeing, you can see posed up by a problem, could be even be death. It could be a lot of underage pregnancies. It could be cases of rape. It could be, you know, issues related, you know, the ultimate manifestation of the problem goes up to death, because the smallest thing that we see will actually boil up and form, will go to the peak, and that's where we are calling a manifestation of the problem. So the purpose of the problem analysis is first to understand how different problems affect different stakeholders. The antibiotic resistance could be affecting different stakeholders differently. And you do problem tree analysis to understand how does it affect people differently. Also, we need to analyze the situation in which the organization, you are going to implement your project in an organization. So what is this situation that you're going to analyze, to do your work? Then you may want to identify a suitable area of, or a section or a sector where you want to implement your activity. Then you need to understand the complexity of a problem, because the drug resistance is brought by a certain complexity, which you need to understand. Sorry, I will put off my video because of the network. So you will need to understand so you'll need to understand the complexity of a problem, its cause, and how it's already being handled. The last reason why you need to do a problem analysis is to analyze the constraint. There are challenges that you need to understand as you implement your activity. What are these challenges that you're going to meet? Now, a problem tree, we can look at it in terms of what this photo looks like. And what we need is to establish the hierarchy of problems in light of the cause and effect. So we want to see what causes this problem and how, what are the effect of this problem. So we want to look at that relationship. And then, then we need to illustrate or post this hierarchy of problems in a way that we can actually see and think about. For us to do that, then we have to do what we call root cause analysis. And this is by asking 5 whys. You have to present that problem and ask why the problem. You get an answer and ask why the answer. You get the answer and ask the answer a question. It will look like something like this. For example, employee turnover rate has been increasing in an organization, and you want to understand the reason why this is going up. The first question you're going to ask is, why is the employee turnover rate increasing? The possible answers, you could get a number of answers at this juncture. So maybe one of the answers you'll get is employees are leaving for other jobs. That could be one reason. Then ask, why are they leaving for other jobs? You'll get another answer, employees are not satisfied. Ask yourself, why are the employees not satisfied? You get the answer, employees feel that they are underpaid. Ask a question again. Why are employees, why are they feeling that they are underpaid? Then you now start getting to the root cause. Other employers are paying higher salaries. Then you ask, why are other employers paying higher salaries? Then you now get to where you want to start addressing the problem. Demand for such employees has increased in the market. These 5 questions will actually give you an idea on how to handle the problem that you have. And this is a technique sometimes planners normally use to get deeper into a number of activities to undertake. Now, these questions, these answers that we have gotten here will now become a problem problem situation analysis, and this can now be put into a tree format. You will now have your model developed this way, and this is something which you will need to practice maybe in details, that you have to present your core problem. The problem is employees, there is a high turnover rate. It's the core problem. Then you ask a question going downwards, what this core problem is caused by. Then you ask what causes this. Then you'll get the answer A, B, C. Then ask yourself what causes A. You'll get A1, A2, A3. You can go as deep as asking what causes A1 and get answers. And you'll develop like kind of a roots downwards, going downwards. Now, then you can ask yourself, this core problem leads to effect 1. Effect 1 leads to, you can get effect 1, 1, effect 1, 1, 1, 2, and go upward. And you'll reach a level where now you may not want to go. You come back to one thing, like death. which will be ultimate here. So this is a problem tree analysis model which you can use to review your problem. Let's see an example. I picked an example. There's an example one which was not fitting properly. Low motivation at workplace. Let's look at that, because sometimes this is what we go through. I'm not motivated to work as a problem, a core problem. Then I get, why am I not motivated to work? Then the answer is, I'm not sure what to do in this work. Why are you not, sorry, then you ask, why are you not motivated to work? Then you get the answer is my salary is low. Then the other answer is I get poor respect from the boss. That's the first round of asking why I am not motivated, and you ask, why are you not motivated? So you get now like 3 answers there. Then you come to stage 2, where now you ask, why are you not sure about your work? Then the answer is, I lack expertise or skills. Why do you lack expertise? And then the answer will be, I lack training. Then why about you ask about the salary, and then you get the answer is that my company is not getting profit. And then another answer you get is my post is not high. Then you get the other question you ask on the third one will now give you an answer on communication. This could be the causes. Now, if you look at this, the deepest where the root has gone is I lack training, my company is not getting profit, my post is not high yet, I communicate poorly to my boss. And if you look at this problem, root causes, some of them are personal and others are company oriented. And this is how you can design a project, 2 projects. You can design projects to train individuals so that they are motivated to work. And the training you can put in communication skills. Another project you look at is how to ensure that the company makes profit so that the salary goes up. Another project will be now the employment policy, where now the promotion is well stipulated so that members understand what is required to move higher the ladder. That's the root cause. But when you go up, when the motivation is not, you are not well motivated, then there will be low production. Why low production? Low production will lead to losses or something. So upward, you find something else. Another example is about water, and I think this one, just want to illustrate the effect part of it. Sorry. So river water quality deterioration, and when you go down, you can ask those questions. I'll share with you this slide so that you can know how the cause effect works because of time. So let's look at the objective tree analysis. Remember what I told you, that when you're developing a problem, when you are developing objectives, goals, and objectives of a project, you must move from problem tree to objective tree. This is based on what I told you, that when you have a problem on one side of the hand, the other side prevails the solution to that problem. And we want to see the things that we have seen in the example, can they be converted to positive to provide now the goal of a project, or give a project with what the project should look like. So, so we have talked about this problem, root cause, and manifestation. But now what we want to look at is means to ends, and we just convert the problem tree into means to end. The under the ground, where we had roots, now the roots are providing the means of handling the problem. And the trunk now becomes the aim. The branches becomes the immediate output, and the leaves and the fruits and all that, flowers and all that, now this is manifestation of the outcome. How do the situation you want to see at the end of the project is at the top of the tree. So what we have just done, we have converted problem tree into positive, and that's what we are looking at. So when you look at the objective tree, it gives us the description of the future situation that we want to see or achieve or solve. It also helps us to identify potential solutions. From the tree, you can see the solutions there. The roots is now the means which we need to hang on to uproot the problem. And it turns, when you look at the problem tree, it turns the negative aspect into positive aspects. And this is where now we desire. So objective analysis or objective tree analysis clarifies the means and relationship that we want to see, and it also provides us with the solution and strategies that we can use to deal with the problem. So we are just saying, if the problem was high rate of child death, now we convert it to the objective, which will be, we have to reduce the rate of death, which is positive. High rate of infectious diseases, then we convert it to reduce the or lower the rate of infectious diseases, which is positive for us. Right, sorry, members, I could not be seeing the chat, but if there is something that requires my address, please, somebody can shout it out. When I'm sharing, I can't be able to see, to follow the chat.
Yes, we are following through.
Okay, objective analysis. For example, we want to reformulate the problem which we had. I'm not motivated to work. How do you change it to results, to means and results? So the first one, and you can see the lower one, get trained. What was there was lack of training. And then it changes to get trained. We have started from the tip of the root. And then lack of expertise changes to adequate skills provided. Then not sure what to do in this work, it changes to I know what to do. Now, the company is not getting profit. It now changes, my company is getting profit. Then the other one changes to the get promoted. Salaries low changes to salaries increase. Now, poor communication changes to better communication. Different ways to think changes to understanding of the boss's perspective. And then poor respect from the boss will now change to positive, respected and encouraged by boss. Now the ultimate, the core problem changes to I enjoy working and I am so motivated. So we are now just changing this one side of the hand, which is the problem, and we face upward to positive. And all the situations here, we have turned them into positive. Allow me to look at another example very fast. And this is where now I want to demonstrate something. There is a situation where incidence of bus accident is high, and this has been a lot of issues. there are incidents of bus accident everywhere. And when you ask a question, the possible answers will be drivers do not follow rules, many technical problems, road conditions. And when you ask deeper, you find that at the tip of the route, we have drivers are not trained, new buses has not been purchased, there's no regular checks, there is inadequate checks, there is inefficient equipment at workshop, something like that. So if we want to turn this situation into positive, then we will just start. You can see what is in red. Bus drivers are trained. Then driver do not follow rules, changes to driver follow rules. New buses not purchased, changes to new buses purchased. Many old buses, changes to few old buses. Regular checks, changes to irregular, changes to regular checks. Then mechanic checks improved. Then sufficient equipment, and then maintenance, bus maintenance is adequate. Then the whole scenario, many technical problems will change to fewer technical problems or troubles. Then we have road condition, which will now change to better infrastructure. And the whole situation now, incident of bus accident high, changes to incident of bus accident is lowered, or low rate of bus accident. That's how you can convert a problem into a positive. Now, how do you select a project out of a problem tree, which is converted into objective tree? How do you select a project out of that? Now, let's use that example of incident of buses. Now, if you look at this, I have put together one branch of the routes into a project. For example, drivers follow rules is a positive thing. Bus drivers train is a positive thing and is supposed to address the problems of drivers not following rules. That one I will treat it as one project, and I will show you how now you can now design objectives, goal out of it, and activity. Another project will be now on maintenance, and I call it bus maintenance approach or project, which has to solve all those problems. And then the other one will be now road improvement approach is another project. So from a problem tree analysis, which is talking about accident increase, we have converted to objectives, and we are able to pick resources into resources that forms a project that can drive us through. So, and this now will bring us to a project which we pick now from there. This is training of bus drivers project. Now, when I thought about it, I asked myself, what could be the possible goal and objective of this training? And I just want you to focus on this, because we are now moving from this and we are carrying one aspect, which is driver follow rules and bus drivers train. We are treating it as one project. You could have 3 projects. There is one project there is another one on bus maintenance, and there is one on road improvement, which is also another project. But we have picked one, and here we have it. So when I thought about it, then I said, then a goal could be reducing incidences of bus accidents by ensuring that drivers follow road safety and rules. That's what I thought. Maybe you could brainstorm on this. And then an objective is now must be specific. It must be measurable. It must be attainable. And you have to ensure that when you are measuring this, it is realistic and time-bound. So I converted now, I came up with an objective, and this objective is based on the second bus drivers trained, the second item, which is here, which now is an objective which we are coming up with. And I say 200 bus drivers in Nairobi trained on road safety and rules by June 2022. This is now the measurability is in 200 bus drivers, right? And measurability will also be attributed to the time frame that is there. And then specificity is also talked about areas that you are targeting and who you are targeting. Attainability is now something that you want to ask yourself. For example, have you ever before trained 200, which is the last training that you did, and how many did you train? You have to start now looking at the resources you have, the capability you have to enable you to train 200 buses. Sometimes you may find that you are going through the recruitment of resource person, or you want to procure an agency to collaborate with you so that you can attain if you don't meet the attainability rate. Then realistic, when you say 200, is it realistic? You know, and realistic will now come with the duration you have placed yourself and the activities that you have, that can you be able to do that. Time bound is now June 2022 introduces now the timeness in this objective. Then after that, decide on an activities. If the first activity will want to maybe carry out a very fast need assessment on drivers in Nairobi, you have to develop a program, a curriculum, what they will go through. You have to do training material. You have to recruit resource person. You have to recruit trainees, and bus drivers are very, very busy, and you must also know how to come up with a schedule to enable them to go for the training. And you must now implement the training, monitor and evaluate the training. So this is how now you can get activities out of that objective. You just think, for you to train, what do you need? You need to know their needs. You need to know, to have the curriculum. You need to have the training. Out of these activities that you're seeing here, there are sub-activities. Like need assessment is not just need assessment. You may want to procure a consultant to help you, or you may want to design, to go through the process of research through that. Curriculum is not just curriculum. It has certain processes. So they are broad in nature. So you must break them down into certain components so that they are deliverable. Then after now picking our project out of the problem tree analysis and then objective, we have designed the goal and the objectives, and then we have come up with activities. Now, then what follows is monitoring and evaluation of the project. And what we monitor and how, what we evaluate and how is what I want us to look at. Why do we monitor and evaluate? To determine project relevancy. And you would agree with me, sometimes we have projects that are not relevant to the situation that they call for. And for us to ensure that projects are aligned to the needs of the society, we must examine the appropriateness of the research in relation to the needs and priorities of the beneficiaries. And the beneficiaries are very key, including in the definition we had talked about that. And then determine project effectiveness, the degree to which something is successful in producing a desired result. So you have activities. Are those activities producing the desired results? You have finances. Are those finances helping you to drive to the desired results? So these are things that we are looking at. And then efficiency. When you use the least to produce the most, we say you are more efficient in the way you are doing things. And sometimes these are very key, because the efficiency is how you use the limited resources you have to produce the desired results. And therefore, we normally look at that. Did you use the finances that you are given to do even more than what you purchased? Did you use this to get more impact? For example, when we train 200 women in reproductive health, are these 200 women going to train at least 5 of each, so that we have a bigger impact? So when we find that the women we train have also trained like 10 each, then that's the impact of the project. Then we say it's very efficient. It was very efficient to use the resources which we had to train 200 to now get more than 200 women understanding issues related to reproductive health. Then we have project sustainability. Your project, when you roll out the project, it must show evidence that it will continue even after your termination. So you must, in the document that you're going to draw, you must explain how the sustainability of the project will look like after you stop supporting the project. You must explain this. Then we have monitoring. Monitoring is, there are two things about monitoring: that there is what we planned to achieve and what we are actually achieving. When we roll out activities, there are certain things you start seeing which are different from what you planned for. So this is what we start now looking at. And monitoring helps us to control projects that may be steering outside the road. So it helps us to return to the road. And there are two levels of monitoring. We monitor the implementation, and we also monitor the results. Now, when we monitor implementation, we are looking at the input. How much did we put in? And how are we using what we put in as required? Then activities. What activities were supposed to implement? Were they implemented as planned? What, if not, what is going on, and how do you ensure that you go back? Then output. Those are things that we look, outcome and impact. I've tried to explain each of these concepts on the one side of this slide so that you understand. Output is the direct, immediate result. Outcome, this is now the changes or attributes in the behavior that we want to see, which helps us to see that we are progressing. That's outcome. But impact is the long-term results. What the change, the permanent change we want to see. That we used to have underage pregnancy, but this situation has reduced, and the girls are empowered to take their own, to take decision about their lives. Evaluation is about when the project is going on. If the project is 5 years, we have what we call formative. Mid that, maybe 2.5 years, you need to roll out a mid-term evaluation. And this is basically to help us understand whether the project objectives are being achieved, and the new changes that the project is experiencing, and how we can adjust and adopt to new changes. Then we have end term or end line evaluation. This is at the end of the project. This is where now you are asking yourself, did the project objective achieved? Were they achieved? And if they were not achieved, what are the lessons learned that can be transferred for future programming? And then impact is now we are now looking at the theory of change. What we saw as a problem, has it changed completely? And is it going to change, to make a permanent change in the behavior, in the attribute of the beneficiary, so that they take the decisions and run with them about their own life and living in a better way? Then when you are now, you're monitoring, we have a number of tools, and I just wanted to talk about one tool. I will be finishing in 1 or 2 minutes. The log frame is one of the tools that is very important for you to document things that you want to monitor and evaluate. Input is the lowest level, where you are now resources, you are putting the resources. The inputs leads to output. The output leads to outcome, and then the outcome leads to the ultimate goal of the project. So it is what we call a vertical logic. From the inputs, you go to activities. Each activities will be having outputs. Then a number of them will produce outcome, and then the purpose. Then we have the vertical logic, where we are talking about inputs. What are the indicators of inputs? Maybe you start now talking about percentage or the amount of finances you're putting in, the resources that you're putting in. The indicators for this must be well designed. And then means of verification, you must actually show the evidence. You must give the evidence that inputs will be able to be monitored against, and what needs to be availed. And then assumption. Assumptions are that situation which you feel should be available for you to attain what you are planning to do. That availability of that situation which must be present for certain things to happen is the assumption that you put there. So output, outcome, and purpose are things that now we are moving from one level. Like now the purpose is broad. For you to verify that you have attained the purpose, there are certain things that you need to do. For example, you must do impact evaluation. You must do summative evaluation for you to determine that. But for the outcome, for you to be able to know that the outcome has been achieved, you could do midterm evaluation for you to ascertain that. But these other things will be maybe daily monitoring, visits, and all that to be able to understand. So this is one of the tools I needed to share with you. And I think with the time we have, I'll just rush what your document needs to look like. Project design, and the project you're going to design must have a background. The background must describe the history of the development of the idea, things like maybe the documentation of how the problem has been prevailing socially, and maybe need analysis that you carried out to show that the problem is existing. And despite, you can also put it in the context, despite many other initiatives, maybe the problem is still persisting and it requires change. The project context is, you must explain the environment under which the project is going to be rolled out, and possible challenges within that environment. And then in your document, you must have maybe document certain risks and how you think you'll address those risks, and then the assumption. there's a difference between risk and assumption. And just want to say is that when you talk about risks, risks are things when they happen, the activities and the project are threatened. The project can stop because of a risk occurring. But assumption is a situation when it occurs, it prepares, it supports you to roll out the activities. So there's a difference between that. We have talked about goals and objectives. You must also post these goals there, objectives. You may have a number of objectives you want to meet. Outputs and outcome, you must also document this. And then stakeholders and beneficiaries and how you will analyze the stakeholders because stakeholders are very important to help you roll out the project. Then activities, you may want to document the activities that you're going to carry out and timeline. Maybe what is missing here is maybe the monitoring and evaluation plan must also be put there with the details of activities and how you're going to monitor each activities and each outcome. That's how the document looks like, the proposal, the project proposal looks like. It's different from research project proposal. So that's what I needed to share with you. I've seen time has gone. And maybe at this juncture, I want to stop there.
Thank you.
Okay, thank you.
Thank you so much. Thank you, Professor Nyonje, for that very, very insightful and informative presentation. I'm sure you have all learned a lot in terms of problem tree, objective tree, how to connect the two, coming up with activities, monitoring and evaluation. So much. I don't want to preempt, and thank you so much. I'm sure that we'll apply the concept that we have learned in our next phase, which will be designing projects that can be implemented during the week and next year. Thank you so much, Prof. Due to time, I would request we shelve the questions for now, so that we first maybe hear from our next speaker, then we'll pick up on the questions after our second presenter. So I would want to introduce our second presenter for the day. So, and our second presenter will be Dr. Ponari Gotipati. So a brief about Dr. Ponari Gotipati. Welcome so much, Dr. Ponari. It's a pleasure having you in the session. So Dr. Ponari is a research management, science and education and engagement consultant in Hyderabad, that is India. And she has an experience of working with education organizations, engaging with school children. And she co-leads the Superheroes Against Superbugs program and was involved in conceptualizing the program, content development, facilitating the workshops and evaluation of the pilot program. In addition, she currently also consults for LLV Prasad Eye Institute, also in Hyderabad, in research management. She's trained in molecular biology and she has a PhD from the University of Sheffield and a postdoc from the University of Oxford. She previously worked at the Wellcome Trust, DPT India Alliance, and she loves celebrating science through engagement and outreach, which inspires her. Thank you so much, Dr. Ponari, for joining us today. So Dr. Ponari will be presenting on a case presentation for a very wonderful project on antimicrobial resistance that they carried out in India. So thank you so much, and over to you, Dr. Ponari.
Thank you, Daniel, for that lovely introduction. I hope I'm audible and my slides are visible to everyone.
Yes, you're audible and we can see your slide. Thank you.
Excellent. Okay, yeah. Good afternoon, everyone. Good morning, I guess, for you guys. Like Daniel mentioned, I'm Ponari Gotipati. I'm actually a scientist turned research management and outreach consultant based in India. And it's my pleasure to be here to talk to you all, young people, about our initiative, Superheroes Against Superbugs. Thank you so much, Daniel, for the invitation. Lovely to be back here talking to these young people. So without much wasting more time, let me introduce our initiative to you. And through that initiative, I'll also touch upon some of the concepts of project management that have been discussed in the previous by the previous speaker. So Daniel tells me that all of you are tertiary students and you're all very familiar with AMR, have had multiple sessions discussing various concepts of AMR. So I will not spend too much time talking about AMR at all, but only that to remind all of us that this is a global issue that needs immediate attention. And, we are all interconnected in this problem of AMR. But even so, the problem, I think, is much more aggravated in countries like India and also in the other lower and middle income countries, including Africa, like this was touched upon in the video that we initially saw in the introductory video. So I'll just talk to you about why we first decided to come up with this initiative and why we wanted to tackle this issue. So India is actually the largest consumer of antibiotics for human health in the previous decade. Research shows that about 64% of antibiotics sold in India are unapproved. 50% of antibiotic prescriptions in India are inappropriate. They don't need to be prescribed antibiotics at all. And again, stressing upon the fact that was mentioned in the introductory video about a very startling fact is that about 58,000 newborns in India die each year due to infections caused by resistant superbugs. Further, India is one of the biggest producers and consumers of antibiotics in the world. About 80% of antibiotics are produced in India and China. Again, the pharmaceutical waste from these companies adding to the problem of AMR in the country. So the problem is aggravated in India because of the increased misuse and overuse of antibiotics, the easy availability of antibiotics on one hand, and the misuse of antibiotics on the other hand. So it's a huge problem in our country. But unfortunately, not many people are even aware of the problem. People have not even heard of the issue of antimicrobial resistance. That is why in the year 2018, 1 year after the National Action Plan on AMR has been implemented has been come out in India, we decided to initiate this program called Superheroes Against Superbugs. And our mission is to create a platform to initiate conversations and public action to tackle antibiotic resistance in India. So the mission here is equivalent to the goal that the Professor Neonji was referring to. So we wanted to create a platform to initiate conversations on this problem of AMR in the country because there was like very little talk happening on the problem. Then we wanted to empower young children with knowledge on antibiotic resistance, and we want to partner with them in raising awareness about its perils. And the people behind this initiative are all scientists. So we wanted to encourage scientists and medical professionals to engage with society at large on antibiotic resistance, science and health. So we wanted to use this platform on one hand to talk about the issue of AMR, but on the other hand, also to encourage the stakeholders to come out and talk about the problem with the general public. So that was our mission. And for this, we decided to work with young children. And the reason for that is because we believe that young minds are capable of influencing behaviors around them and also bringing about transformative change when they're equipped with right tools. So we were very conscious when we chose our target audience, right? And again, I think as young people, as you've gone through multiple workshops already on the need for involving children and young people in tackling AMR. But very briefly, I'll talk about our thinking behind choosing this particular target audience. So again, half the world population currently is under the age of 30. About 90% of them live in LMIC countries. I think 42% of world's youth will be living in Africa by 2030. And currently, India has world's largest youth population, right? Every third person in India currently is a young person. Despite that, they are the most underrepresented group in policy making and civil society. But we believe that they bring in a very unique perspective. They understand their own needs, but it is unfortunate that there is a missing representation of this group. That is why we wanted to bring them onto the discussion table. We wanted to give them a voice. And we also believe that health and well-being and problem of AMR is central to their future and well-being. And by bringing them and giving them a voice right now, we are creating a foundation for their healthy lifestyle, which will be sustained into their adulthood. They are the future leaders of the world. They are the future consumers of antibiotics, and therefore we believe that it is very important that they play an active role in tackling the issue of AMR. And on the other hand, we also believe that they make perfect agents of change for an issue like AMR. One, because of their energy and enthusiasm, because of their positive outlook. They're not bogged down already by, by the humdrum of life, by the, all the issues that come up with adulthood. So they have a positive outlook. So we wanted to tap into that energy and enthusiasm. The cynicism that many grown-ups have about bringing about a change in the way things happen in the world hasn't reached these people yet. So they believe, they have a confidence in change. They believe that, that they can make a difference in this world. So we wanted to tap into that, that positive outlook also. And of course, the creativity and imagination that children and young people bring in, we also wanted to tap into that huge resource that these young people have. So that is why we chose to work with children, because we believe that, again, that issues like AMR and climate change, which are central to their future and well-being, need children and young people as catalysts for change. And we also believe that it is important to create opportunities and platforms to share responsibility in shaping their future and well-being. And why did we choose to work with high school students? So we basically did a bit of research, again, when we wanted to work on the problem of AMR community engagement. Then we did a bit of research and we realized that the school curriculum in India introduces the concept of microorganisms and microbes in 8th grade. So we wanted to build upon that knowledge and then introduce the concepts of antibiotics and resistance and how it spreads and all the other scientific concepts to the people who are already familiar with this. That is why we chose this age group of 13 to 14 years, because they're already familiar with microorganisms. And we also believe that at that age, they are capable of understanding the complexity of AMR, not just the complexity of scientific concepts, but also the societal complexities and the environmental complexities that AMR brings with itself. So we believe that this age group is the right target audience to be able to understand the complexity on one hand, and also they are capable of bringing about influencing the people in their sphere of influence, right? In their communities, in their immediate families, among their peer groups. So that is why we consciously chose to work with this particular target audience. So as you would see already, we are bringing in, the planning of the project. A lot of thought went into choosing the people that we want to work with. So we wanted to partner with school children by equipping them with knowledge of the issue through creative and fun hands-on activities. So now comes the next steps in designing the project. Okay, so we want to work with school children. So what is the right mode to work with them? So basically, because these are school children, we chose the route of using science education to reach out to them about AMR. But at the same time, we did not want these children to feel that they're attending another classroom, another lecture, another science lecture. We wanted it to be different. So that is why we chose the path of using creative, immersive, and fun hands-on activities. We came up with all of these games for them to play. And we came up with all of these activities with things that they can do with their hands. and at the same time learn about the concepts of AFR. I'll just very briefly give you an example. So for us to teach them the concept of superbugs, we chose this very simple game where there is a patient, the patient has an infection, and the infection is caused by bacteria, and the bacteria are nothing but so in order for them to visualize this problem, we didn't want these to be abstract concepts. We wanted the children to visualize the problem, right? So we put some boiled chickpeas into a bowl, and we told them, okay, this is your patient, you are a doctor, the patient has this bacteria, which is giving this patient this infection. So as doctors, what would you do? Okay, you will prescribe an antibiotic. Okay, here is your antibiotic. It is a toothpick. Now, use this toothpick to get rid of the bacteria, the infection-causing bacteria out of the patient. And then we turned this into a game, right? So we divided these people into different groups, children into different groups, and we told them that you have these many seconds to administer each dose of antibiotic. So the time is now equivalent to course of antibiotic, right? And then so we tell them, okay, one course, how much bacteria were you able to take out? Second course, how many more have you managed to? End of the course, I mean, midway through the course, have you managed to completely rid this patient of the infection? No, because there are still some chickpeas remaining. At the end of the course, at the end of the 7 doses, did you manage to completely cure this patient? Yes, you have. So now do you see why it is important not to stop using the medicine halfway through? So similarly, for introducing the concept of, and also we also taught them the science concepts, right? So we like, how is this antibiotic able to act on this bacteria? Okay, so how is this toothpick getting into the chickpea, right? The chickpea is boiled, therefore it is soft, and therefore the toothpick is able to go into this bacteria. Similarly, the bacteria also have an outer covering, a permeable cell wall, through which the antibiotic can actually get inside their cell. And because the antibiotic can get inside the cell is how it is able to act on the bacteria. So now imagine what happens if this bacteria changes its cell wall in such a way that the antibiotic is not able to get in. That is what happens in case of superbugs. Now we give them some chickpeas which are hard, which are not boiled. So what is the difference between these chickpeas and these chickpeas? These chickpeas are hard, their toothpick is not able to get inside them. Why? Because these bacteria change their outer covering, change the cell wall in such a way that they're stopping the antibiotic to even get inside them. And therefore, the antibiotics do not work on the superbugs. And similarly, so this is just to show you how they were, you can see the smiles on their face, right? They're actually competing with each other to get rid of as many chickpeas as possible. So it makes it fun, but at the same time, they're learning the science concepts. And similarly, we then tell them that, now you have another patient, and this patient actually has viruses. So we give them some lentils instead of chickpeas. And then we are like, okay, now you try to treat this patient using an antibiotic. Can you? You cannot, right? Why? Because you cannot, the toothpick is not able to poke. Why is the toothpick not able to poke? It is not able to poke because it is not soft. It is very hard. Similarly, the viruses also have something called a capsid around them. And this capsid prevents the antibiotic from even getting inside. And therefore, no matter how many doses of antibiotic you use, there is no use because it will not act on the virus because it can't even get inside the virus. So this way, by coming out with these hands-on activities and by turning them into games, the children learn these concepts in a very fun way. And once we've equipped them with this knowledge, what we then did, we provided them with a platform for interaction with different stakeholders like scientists and doctors. And why did we do that? Because again, it is very important for these children to see that there are people out there who are trying to tackle these issues, right? And then what can we do? At the end of every session, we didn't want these children to leave with a doomsday scenario, with like all doom and gloom that there's this big issue, we can't do anything about it. We wanted these children to have some call to action, to have some actionable items that they can that they feel that they are empowered to tackle this problem. That is why we felt that it was important for these children to see these people who are actually trying to tackle this issue on the ground. So, for example, we had a pediatrician come and talk to these children about hygiene and sanitation. Why is it important to maintain hygiene and sanitation? Why is it important for you to take vaccinations? Why is it important for you to drink good water? You know, why is it important for you to eat nutritious food? Why should you wash your hands? So because the pediatrician, the doctor who's working on the ground tells them about all of this and what they can do, the children feel much more empowered to act. And similarly, you know, we brought in scientists who would then talk to these children about how they are trying to tackle the problem of AMR, right? I mean, how do they study microorganisms in the lab? How do they come up with new drugs? Why is it proving to be difficult to come up with new drugs? And why is it important to conserve the drugs that we already have? And, you know, all of this they hear from the horse's mouth, from the scientists that are actually trying to tackle the problem. So that gives them, you know, like this, on one hand, the real scenario of how people are trying to tackle the problem, and on the other hand, what they can do to help these people that are trying to tackle the problem of AMR. So, you know, the title of our program itself is called Superheroes Against Superbugs, right? So we show them that there are all of these superheroes, the medical professionals, the scientists, the policymakers that are trying to tackle the problem, but you yourself can also become a superhero by doing these simple things. So that is the, so we bringing the, we kind of making the children own the problem, right? Not just the problem, but also the solution by taking this approach to this problem. So the next thing we did was we also inform our program, and also we were trying to solicit children's own experiences. So again, yes, great. You know, they learn about all the different aspects of AMR through these hands-on activities and through games, you know, the problem of misuse and overuse in humans, the problem of misuse in poultry and animal husbandry, the problem of environmental pollution, what are doctors trying to do, what are scientists trying to do. So they have like a very good understanding of, you know, what happens, the issue of AMR itself. But there is also a problem that they will look at it as a problem that is out there, right? There is this big issue that, but why where am I? Where do I fit into this big problem of AMR? So that is why we wanted to solicit their own experiences also. And the way we did that is by giving them homework to go and talk to their parents, to have a dinner table conversation with their parents about how they use antibiotics in their household. When was the last time they have taken an antibiotic? Did they get a prescription, or did they just go to a pharmacy and buy the antibiotic? Do they actually store antibiotics in their home? Do they take antibiotics when they feel a little unwell, when they have a cold, without consulting a healthcare professional? So by having these conversations, they realize that they are central to the problem as well. They are as much a part of this problem as, you know, as someone else or as people out there. And similarly, we gave them this exercise where they would go and with their parents, they will go to their pharmacy, a local pharmacy, and try to buy antibiotic over the counter. Did they manage to do that? Did the pharmacist know that they actually cannot give antibiotics without a prescription? Did the pharmacist actually spend some time explaining to the customer then how to use the antibiotic, the importance of finishing the full course of antibiotic? I mean, were they aware that they were not supposed to sell antibiotics without prescription? So again, by doing this exercise, the children realize what happens in their immediate community, right? I mean, the pharmacy, their local pharmacy, how is it dispensing antibiotics? Are they also adding to the problem of AMR? So this way, by soliciting their own experiences, we make the children own the problem and also the solution. So then what we did, once we equipped them with knowledge, we then encouraged these children to come up with stories, you know, narrate their own stories around the issue. Take one issue that you could relate to out of all of this that you have learned, one issue on AMR that you personally relate to, and then come up with a story around it. And then you turn that into a comic, something called a grassroots comic. And why did we choose grassroots comics? Because we believe that comics as a communication tool is very powerful because, it is we believe that everyone has a story to tell and that everyone can turn into an artist. It's a very powerful medium of expression because you can express very serious issues in a very uniquely creative way with a tinge of humor. And they're very simple. These are just black and white, very cost effective because all you need is a pen and a paper. They're very easily reproduced and exhibited. You can just photocopy them, take black and white photocopies, and you can exhibit them anywhere you want. And comics inherently appeal to both children and adults alike, right? All of us love reading comics. And then because these comics are not made by some artist out there, but made by the children that they are familiar with, there is immediate bond that forms between the person who is the children who have made the comics and their communities and their peers and their families. So it becomes a very powerful medium. So we've encouraged all the children from our workshops to choose one particular area that they want to focus on, come up with a story, and then turn it into a comic. And we worked with this organization called World Comics India, and they helped them, turn these into comics. I'll just very briefly show you a few comics that these children have come up with. So this is a comic where the person actually shows a very complex scientific concept in a very, very simple way. So there is the good bacteria and the bad bacteria fighting, they're having a race in our stomach. And the good bacteria actually has an advantage, it's actually winning. But then what happens then is a person goes and takes antibiotics unnecessarily, and then now the bad bacteria actually have an edge because the good bacteria are all dying because of the antibiotics. And now the superbugs, the trophy goes to the bad bacteria. So very simply, the person is showing that by taking antibiotics unnecessarily, you're giving an edge to the superbugs, whereas the good bacteria are all losing out. And here there is another comic where through humor, the student is saying that, the bacteria are actually having a fun conversation. And then they're saying that it's so nice of these humans to keep giving us antibiotics because they just keep making us stronger. And then the other bacteria is saying, I agree. I wonder when they will realize that they're actually helping us, bacteria, rather than themselves. So again, there's a call to action here saying that superbugs are here forever and preventing them is now or never. And these are all ideas by these children, right? I mean, they came up with these concepts and with these ideas. And this is a comic about the need to take doctor's advice before taking antibiotics. And the doctor is telling them that, medicine is not a child's play. We are here to help you, and misuse is no use. So please come to us for advice. Don't go and, take the antibiotic on your own. And this is a comic where they're talking about they're talking about the problem misuse in poultry industry. And the chicken itself is actually saying, please don't buy my eggs because I have superbugs because my owner has fed me with antibiotics. This comic talks about the problem of pharmaceutical waste getting into their water bodies, causing problems for the local community. So these are just some examples. So we've taken a very unique approach to community engagement of AMR, and we've combined science education with public engagement. And again, here, the concept of design, why we chose this method because we were working with school children with our target audience in mind. And we are also very unique and innovative in that we've used comics as a tool for education and empowerment. And we are also very unique in that we made these young children creative partners in our endeavor to spread awareness on AMR. And we've empowered them to spread awareness through their own work. So just very few reflections on how we went about these different stages of planning the project, how we've rolled out, how we've implemented it, and how at the evaluation. So as you can see, a lot of thought went into each and every step of the project. coming from the title, why did we choose the title Superheroes Against Superbugs? One, I already told you that, we believe that we wanted to give out a message to the children that you yourself can become a superhero against this fight. But we also chose this title because children of that age group are very fond of superheroes. They connect with superheroes. They all have their favorite superhero. So it also helps us to attract the students' attention on one hand, and again, giving out a message that, hey, you know what, you yourself can become a superhero by taking these very simple steps and doing these simple actions. And again, we chose the mode of science education. We chose the mode of grassroots comics because we were working with school children. So again, the methodology that you choose also is very important, that you keep your target audience in mind when you choose a particular method. And when it comes to rollout and implementation, again, it is very important that you bring the right people on board, right? For example, because we chose science education, we worked with collaborators who had some prior experience in working with school students, prior experience in coming out with lesson plans and content for school engagement. And we also, chose our partner, the grassroots comics partner, World Comics India, because we were working with school children. So again, yeah, comics would be the right medium to engage with them. And also, right from day one, we were very conscious about the materials that we wanted to use for these workshops, because we wanted to keep our workshops very cost effective. So be it the chickpeas, be it the stationery we used for our games, be it the grassroots comics, a pen and a paper, we were very, we chose materials that were available very easily, that were available in any rural area, in any corner of the country, because when it comes to scaling up and sustainability of the project, these things become very important, right? So again, how while we were designing the project itself, we were very conscious, which we kind of already took stock of, the scalability of the project and how do we sustain this going forward. And evaluation, again, is another thing that we were very careful about. So evaluation can never be an afterthought. You should always think about evaluation right from day one. Which evaluation method will you use? How will you evaluate your project and the impact and the outcomes? Because, it is very important that, for example, with our project, I'll just give you an example of our project. It's very important that you already know how much knowledge the target audience have. Because if you choose a top-down approach of just showering them with content, they may not like it. It's important that you understand what knowledge they have and then build on that knowledge. And so the very first step is also evaluation. Evaluate how much knowledge and what understanding your target audience have, and then you design your project based on that knowledge. So we did some pre-evaluation before the workshop to understand what knowledge our students had. And then after the workshop, again, we evaluated what the increase in knowledge has been. And because we chose science education, it was easy for us to evaluate the increase in knowledge that these kids had after they've gone through our workshops. But at the same time, when we talk about the impact on AMR, when it comes to community engagement and impact on a problem like AMR, it becomes very difficult to measure, right? Because behavioral change, how do you even measure it? So that is why we actually went back to these children. So science education increase in knowledge was easy for us to measure, but the impact on the ground and whether there was any behavior change or not was difficult to measure. So we chose a route where we went back to these children 3 months after the workshop and then 1 year after the workshop to kind of understand what have they done in these 3 months? What have they done in this 1 year? Have they actually exhibited their comics anywhere? Have they actually engaged with their communities, with their families, with their peers? Have they told anybody about AMR at all? Have they displayed the comics anywhere? Have they spoken to, have they brought about any changes in their own, like, do they take antibiotics a little differently now or not? What about hygiene and sanitation? Have they brought in any changes in their lifestyle when it comes to these? So we held these focus group discussions and went back to these children repeatedly to understand if they're still connected with the issue or not. So that is how we have we've designed our workshops. And so for us, impact, there is a direct impact and there is also an indirect impact, right? So the direct impact is all of this that I talked about right now. But the indirect impact is that we've initiated the much needed dialogue on AMR among different stakeholders. And we are encouraging researchers to get involved in societal discourse on AMR. We are reaching out to different sections of the society on AMR through these comics of children. And by garnering interest of both schools on one side and research community on the other side, we are bridging, creating a bridge between these important stakeholders to take this mission forward. And again, Professor Nyonji was talking about outcomes from the pilot. So our output of the pilot is our educational content and the engagement content, the grassroots comics and all the lesson plans. The outcomes from the pilot have been that, that the research institute that we partnered with, now they hold regular workshops on the issue of AMR. The participant schools that have gone through these workshops also hold regular sessions on AMR in their school programs. And we've also initiated a dialogue among the other participants, right? Not just the school students, but also the teachers, but also the technologists who've been a part of our workshops, the grassroots comics artists, and then the parents, and then the pharmacists, and so on and so forth. And so we are, through these comics, we are inspiring all of them to creatively engage with the public on AMR. And there have also been some tangible outcomes, some behavioral changes. For example, there was one school that has installed dustbins and soaps and good hand wash practice. And they have come up with this program where every week they would go and clean their entire campus. And the children themselves have initiated all of these. And we've also, some children have told us that they have gone out there and they have put up these grassroots comics on all their local pharmacy shops. There were also cases where the children said that their family is now much more conscious about taking an antibiotic. They don't go to the pharmacy and buy antibiotics over the prescription. So all of these are positive outcomes that have come out from the pilot. So I will not dwell on this at all, except to tell you all that no matter how much you plan, there will be some challenges. So you should also be very flexible in your approach so that you are able to tackle the challenges that come out. And always remember to sort of, I've already talked about this, always remember to take these lessons, from whichever project you run, there will always be lessons. So always take these lessons in the positive spirit and then try and implement some of these lessons in the other programs that you will then do going forward. For example, for us, an important lesson has been that to maintain sustainability, if we want these children to continuously talk about this problem, then it is important that they own the problem, that they recognize and own the problem and the solution. And another important lesson that we actually did not build into our program itself is that different socioeconomic groups will understand and relate to the issue differently. This is something that Professor Nyonji was also referring to, right? That you have to, the target, or depending upon the target audience, your method needs to change. So for example, in our school program, we've conducted a pilot in a private school where people from upper middle income countries attend these schools. And we've also conducted it in a government school where there are children from lower socioeconomic groups. And these two groups of children would have related to the issue very differently. For example, for the private school children, they connected with the issue of misuse and overuse and, buying over the counter and all of that much more. Whereas the children from the lower socioeconomic backgrounds actually related to the issues of hygiene and sanitation much more than misuse and overuse. Perhaps because they don't even have access to antibiotics, right? So this is something that we have not thought about when we initially designed the program, but but we have taken it in our stride now, and we are much more conscious now when we talk to different school students. We always design and customize our workshop in such a way that we are able to give these children something to connect to. And also that, yes, I mean, this I'm sure is very, very applicable in your case also, that English as a medium of communication is not always going to work. It is very important that you develop these programs and this awareness material in different local languages. So these are some of the lessons that we have learned and that that are perhaps useful to you. But the more important point is that it is important to evaluate whatever you do, because there will be these important lessons that you can then implement in the future programs that you come out with. So again, this is just to show that the program, the pilot, has actually garnered a lot of international attention. And we are now rolling out the second phase of our SAS program with helps from the Stop a Superbugs initiative by British Society for Antimicrobial Chemotherapy. So what we've done after the pilot is we've put our education and engagement resources on our website. This is free for everybody, anybody to use. So if any of you are interested in using some of these resources, please feel free to go to our website and to pick up some of those resources. And we have, over the past 2 years, we've reached about 558 school children in this age group directly, from 75 different schools in 4 different cities in India. And going forward, and of course, the hope is that these will then become champions in taking this message forward in their own communities and in their own peer groups. And we are now trying to scale up the initiative, and we are coming up with train the trainer sessions and teacher training sessions, and also online virtual engagement content also for AMR. So this is what we're going to be doing in our second phase of our program. So finally, thank you to everyone, and just to leave you on a positive thought, that, like I've been saying from the beginning, we believe that everyone needs to become a superhero against superbugs, and these are some of our superheroes.
Thank you so much, Dr. Ponari, for the wonderful presentation. We really do appreciate, and I'm sure that we've all learned something from the theoretical aspect of it, now to seeing what has already been done, you know. So I wouldn't want so much to belabor on what has already been said, because at least I'm sure you have really learned a lot, and we'll incorporate all these learnings to when designing our projects. So we'll have a few minutes for questions, because I can see we are almost we are past time. So Professor Nyonja will give you 5 minutes, please. You can share maybe the screen. I'm sure some students shared some questions or comments on the Jamboard. Then we'll proceed over to Dr. Ponari. Thank you.
Yeah, can you be able to see my screen?
Yes, we can see your screen.
Thank you. I want to thank members who are able to get to the link and post some insight and the feedback to my Jamboard. It is still open, the link is still accessible. So the feedback I'm getting is in 2 ways. One is aha moment, what I call aha moment. Members saying it was a wonderful presentation, thank you so much. Others are saying thank you so much, Professor. I have learned a lot. I really appreciate this. And then Tumwesingye says that this is a wonderful session. I've been having trouble doing problem analysis and deriving a project from this analysis. I'm impressed and informed by your presentation. And then I think there is a question which he posted, which I'll look at it. Then there are another member saying, wonderful presentation. I didn't want you to end. I'm sorry, I think because of time, we could only do that much, but I'm going to share the slides with you so that you can go through. Then I got some question as feedback. I think it is Tumwesige who said, I'm having a problem differentiating project objective and project goals. I think in my presentation, I was very clear, and when you get my slides, you'll be able to read and it will come out clear. Maybe I rushed through. But the project goal is the purpose the project is being implemented. And the difference between the project objective and the project goal is that the project goal sometimes is very broad, and that's why I said it is stated in general terms. Maybe what we can say to make it very clear is that the goal of the project could be contributing to some effort outside there. So you alone with the project cannot satisfy the project goal. But what is very specific to your project, that come the end of your project duration, you must achieve is the project objective. It is very specific on what deliverable is required. It's very specific on what it requires to deliver to the beneficiary. And that's why we say the project objective must be smart in a way so that it helps you to design activities, it helps you to determine resources around that project objective. So that's what the project conveys. But project goal is broader, and the effort your project is providing is just contributing to a broader goal, which has a number of efforts outside your project. Then another question is that, thank you so much, Professor Raphael, for the wonderful presentation. And then the question is log frame the same as the project design matrix? Log frame has, in many aspects, has been talked about as a project design. Some people call it a project design. Why? Because it serves two purposes. It serves to document the project, and two, it's a platform for evaluation. Therefore, I have seen so many people coming up with the different names. Yes, I want to agree that project design matrix is the same, conveys the same information as log frame, because they have actually been used synonymously, so it is the same. Clarify on the difference between root cause and underlying cause. Root cause, if you look at the image of the tree, the root cause cannot be seen. They are under the ground. The underlying cause is something that you can see. It's something that you can see, that it's outside the ground. It's like the trunk. It is like the trunk of a tree. And in most cases, the underlying cause is mostly said to be the core problem. And it is seen as the trunk, is seen as the first section of the tree after the roots, the first section of the tree that you see above the ground. And this is very important so that you can understand. And this is what we everything rests on. The leaves, the trunks, the fruits depends on the support of the trunk or the part of the tree immediately after the ground. But what we know, what I really need you to take home is that we think about the roots of a tree when we are thinking about the problem which is persistent in the community and requires being uprooted. What happens is that if you don't get all the roots that are under, some trees are very stubborn. With only one root in the soil, it will germinate into something else. So you, as a planner, you must ensure that you get all the root cause. And sometimes problem tree analysis is not done as an individual. Maybe if you are a consultant, you can get people into a meeting and start brainstorming about this problem for you to get the problem clear. So it may not be, you may do it alone, but it's most recommended effectively that you can do it in a group of people who are experiencing that problem so that they bring it out. I want to thank you for listening to me, and I hope what we have shared will be beneficial to you. And maybe towards the end, I'll share with you my contact so that for anyone who wants to reach me, you can reach me and we can share. Thank you so much.
Thank you so much, Prof, for that. Over to you, Dr. Ponari. I see we don't have questions in the chat box. Just a lot of aha moments. Oh, there's one question and a lot of realization that there's a lot of ways in which we can create awareness on AMR, help people on the problem, and a lot of appreciation coming in. A lot of people saying what a very innovative and very illustrative way of communicating about AMR. We have one question from Saddam, and Saddam asks Dr. Ponari, what is the best way to consider? What is best to consider when? Maybe Saddam, you can press your question once more, but I'll try to read it. Which is best to consider when implementing a project? Is it the benefit analysis or need analysis? And what did you consider when choosing the school children?
That's a very technical question. I think Professor Nyonji probably would be able to answer this question better, whether one should consider benefit analysis or need analysis when implementing a project. But I'll just talk about our own project. So when we chose the children, I think we perhaps considered the benefits more than the need, I think, because when we chose school children, a lot of people were actually quite, they were like, why school children? I mean, they don't even call the shots at home. I mean, they just have to take whatever the parents give them. So why are you concentrating on children instead of concentrating on the adults? And some others were like, you should go talk to the doctors. Why are you even talking to the children about this problem, right? So I think, so our answer to them was that, but it's very difficult to get these adults to listen to us because they already have these preconceived notions. They already, they have 101 things going on in their head, and it's very difficult to get them to understand the problem on the ground. Whereas the children, through the children, it's a lot easier to get to these. So our end goal actually is to reach the adults only. But we have chosen to reach the adults through these children. So I think though the need out there, I mean, I don't even know if I'm making any sense, but what I'm trying to get at is that even though the ultimate need is to reach the adults, we have chosen the route of the children because we feel that it's easier to reach to the adults through the children. And therefore, I think thinking back, I think we probably considered the benefits more than the needs when we implemented the project. I don't know if that made any sense at all, and if that answered your question.
It made a lot of sense. Thank you. I think you used very technical concepts, but I do understand what you're saying, maybe to complement what you're saying. And there's also the aspect of, for children, they're the future generation. So, you won't have to maybe redo all this all over again. You can still reach to the parents, but still educate the children such that when their time comes, when they're adults, at least they'll be really sensitized about this. And also the issue of behavior change, as you shared in your presentation, it's very hard to, that's why even this program is designed for students, young leaders in health, so that when you transition to to healthcare providers, then it will be very easy to adapt these new concepts that you are talking about, be very sensitive, because relating all this with people who have been in practice for over 20 years, it becomes quite difficult, because already they have reinforced behaviors and all that. Yeah. So thank you so much. And it has been a wonderful session. At least personally, I've really learned a lot, and I'm sure that we have learned much too. So at this juncture, I'll give Professor Nyonje a chance to share your final remarks with us. Then we'll proceed to Dr. Ponari. Thank you.
Yeah, it gives me actually great pleasure to speak to young people about pertinent issues in life. And some of the issues I've had, even my colleague Panari sharing, are very encouraging. And it's a very simple way of just transforming life around ourselves. People who have done much in life are not doing bigger things, just small things like being able to handle children, small children, and shaping their life is very important. It gives you that satisfaction. You guys, I think, have been going through this training. And I think it's a very good training. It has a lot of positive things, and it is intended to change you, to change the world around you. So I just want to motivate and encourage you that what you are learning and what you've learned here is very important. And I think the whole world is waiting to see what you react from this training. Any training, take it as an opportunity. Any sharing, take it as an opportunity of adding an extra learning to your life, because life is about learning. We will not stop learning. As I was presenting, I was also learning. I was listening to Ponari, and I was very intrigued with the project that she's running and what she's going to achieve for the community around her and other people. Let's talk about the situation around ourselves before we start talking about the situation around somebody else. That situation around you is what you need to start with and address it before you walk out to address a situation around other people. Your own community is very important because that's where you live, and you need to see how to change the situation. I have just talked to you about the tool that you can use to change situation. I have not even exhausted. Because of time, I was able to share what we shared. But I just want you to be transformed, to transform. Thank you so much.
Thank you so much, Prof, for that parting shot. I believe it has been impactful to all of us, and we will welcome you once more. We hope that we'll have another batch of young leaders too, and train them once again so that they can go there and make a lot of change. Over to you, Dr. Ponari.
Yeah, thank you, Daniel. There's one question in the from the audience. I'll just very briefly address that and then give my parting remarks. So why did we choose 13 to 15 year and not 15 to 18 years? It's a very practical problem for us because children from 15 onwards have board exams and they're very, very preoccupied with their board exams and their career prospects and then, what they want to do with their life and all that. So usually, so we felt that, touching, we will not be able to get the kind of engagement from them that we would from slightly younger children. So it's a very practical issue that prevented us from, taking the other children on board. So with that, so once again, thank you so much, Daniel. Thank you for what you're doing. Thank you for the program, Students Against Superbugs in Africa. You've been doing some wonderful work. I always follow what you do on Twitter, and I'm always amazed at how much you're able to do despite the pandemic. And to all the youngsters who have joined us today, you are our superheroes, and you've taken the first step in, making a difference to, to the world around you. It's a brilliant thing. Keep going at it and keep doing wonderful things. Thank you so much for this opportunity.
Thank you so much, Prof. Nyonja and Dr. Ponari, for the, for making your time. It's always a pleasure to have, senior expertise, grace the occasion, and your immense willingness to attend. I know there are many other things that you'll be doing, but just preparing the presentation, taking your time to explain all these concepts, it really shows a lot of passion and willingness, and we are really thankful for our students. Thank you so much for attending the session, and I hope that you've learned something that we'll use when designing the project. So because of time, I would love us to end here. As we have shared, we'll have another session next Saturday on the 9th, and we'll now be explaining more on how we'll carry out this in upcoming projects. So thank you so much all, and I wish you a very wonderful weekend, and enjoy your weekend. That's all I can say, and bye-bye everyone. So you can just unmute and say bye as we leave. Thank you.
Thank you.
Bye-bye.
Bye-bye.
Bye.
Okay, bye.
Bye. Nice weekend.
Bye.
Group
Bye.
photo.
Bye. Is there a group photo?